Welcome to Let's Talk About Death. I'm Tammy Beilstein.
And I'm Sarah Lunsford.
The last episode we talked about what
happens
1 to 3 months out.
months before someone passes away, someone dies.
And now we're going to jump forward to 1 to 2 weeks before someone dies. Now there
She'll start to get some significant changes in that time frame in their behavior.
Right. In the physical changes too, the breathing can become more labored. Their heart may not be working as strongly as it did before. When they're sleeping, they might be harder to wake up.
Okay.
The responses
Is
are
just
slower.
Yeah. Slower.
Yeah.
Okay.
And then there are things like you were telling me about the agitation.
They call it picking at the clothes.
Yeah, tell
picking
me
at
about
the
that.
bedclothes.
You've seen that.
But we were talking about that, and I've seen it a lot in research that I've done for history articles that I've written. When you go and you read in the journals from 100 years ago, 200 years ago, they talk about when someone passes away, they know about they know that it's coming very close because people start to pick at the edges of their blankets while they're in bed.
I wonder why.
I don't know. I've never
though.
seen anything that really describes why that is, but it's always kind of a sign that their dying is very, very close.
The only thing that I have witnessed myself is doing things like this, but I think that's because their body temperature runs from being very hot to very cold and they might be sticky or clammy, and so they're doing that. But
this is a little different. This is when they're literally sort of doing this with both their hands on the edge of their blankets.
That is interesting.
So it's not pulling it away from them or anything like that. So
and sometimes they get more irritable. That's absolutely normal also. And one of my favorite things is when they start to maybe get visits from the other side and they see and hear spirits. Sometimes they are angels that they do not know.
Okay.
But often it is family members from the past that have come back, and I think just to calm them and I don't know, welcome them home.
I guess so.
But that happens so often.
And it's so often, then you shouldn't really discount it.
No.
And that's important too. When someone is passing away, sometimes you have to step, and they say this with dementia patients as well, step into their reality instead of expecting them to come back out into yours.
Right. You don't want to start an argument over something like that. Like really? I don't see anybody. That's not going to be helpful. That's not helpful.
No.
So ask them, what are they saying to you? What are you seeing? A lot of times it has to do with travel. Did you know that?
Oh, no, I didn't know that.
Yeah, they'll be getting messages like, oh, I think I need to start packing my bags. We're going to go on a trip.
Oh.
Or they'll talk about plane rides or train rides or things like that. It's really interesting. I just love it. It's one of my favorite things to see.
That might be a few segments.
Okay.
We may talk about that a few segments.
Oh, sure.
Yeah.
I love that.
Anyway, that's it for this segment.
Yeah. I think so. Well, we didn't mention the physical changes. There will be a lot of physical changes. It's all absolutely normal. And again, it depends on what sort of diagnosis they've had, what it is that they are dying from. Depends on what sort of physical changes you will see. If anything worries you, you're not sure about it, ask the doctor. Just give them a call.
Knowledge is your friend.
Yeah.
Yeah, definitely.
Absolutely. Okay.
Thank you.
Thanks.